Earlier, I was like your friend of fifth class. Now I am a college mate now.
No,
I
sir, you
love
are my
it.
patient.
I love it. I love transformation. I am not monotonous. There is perfect transformation every time we do something. If earlier, I was like your friend of fifth class. Now I am. So I love transformation. No time repetition will be the same like the previous one. Yeah, here. Ten 57. Yeah. So there you are, all cheer up for your battle. But I am also grown stronger. You remember, this time you will see a bigger enemy, a stronger enemy, a better fighter. So get ready for that also. Yes. Hello and welcome to Seven Sentinels. This is Grand Master Class, and I am Peter Simon with you. Today we are conducting the speaking sessions, and here we have with us Essa Suleman, originally from Pakistan, currently staying in Saudi Arabia. Yes, Essa Suleman, the stage is all yours.
Sir, can I start right now?
Yes, of course.
Okay. So, good morning.
Good morning, nurse.
My name is Issa. I am nurse here, and I have just saw your daughter, and I have just taken her vitals. So I would like to know more about her symptoms. May I?
Yeah, definitely, nurse. Okay, what sort of information do you need?
Okay. First of all, I would like to ask you, how may I address you?
You can call me Martha, and my daughter is Elizabeth. She is just 3 years old.
Yes, absolutely right. I know her. Just now I get her vitals. So she's quite stable right now. I would like to ask you some further questions. So,
Yeah,
first
of
of all,
course.
I would like to ask you, when did it start?
Yeah, this started. Yeah, I exactly do not know when it started, but she came running home and she was in pain, So I have
Oh,
brought her to the emergency department. She has chest
okay.
tightness, wheezing, and difficulty breathing.
Mhm. Have you noticed any triggering?
I don't know exactly what happened, nurse. It might be the plants or dust or any sort of insects, or I don't know exactly what it was. But I think it's better you find out. No?
Okay, please, I'm so sorry, but I need to just know about sweetie. Please, could you explain to me? Do you know about that? Are you given any treatment to her at that time?
Yeah, of course. I did
Mm-hmm.
not give any treatment. I did
Okay.
not give any treatment because I did
Well,
not know what to give. I did not really understand the situation. And she was actually, um, you know, in pain, and I thought that if I take give some medication, maybe if some problem arises, I thought better to bring her to you, so I brought here.
Very good. It's very nicely, really. But there is one thing. Are there any previous occurrences?
No, no, nurse. This is the first time she had. She never had anything like this before.
All right, Miss Martha. So, for further proceeding, I would like to ask you a couple of more questions, if you don't mind.
Yes, please.
Okay, please could you explain to me about her general health, or there is
Uh,
any illness?
yeah, my daughter is generally healthy. She hasn't
Mm-hmm.
been ill recently, and she isn't
All
taking any
right.
medication.
Okay. So, does she have any family history of asthma, hay fever, or eczema?
No, nurse, nothing like that. She's perfectly fine. One thing. Let me tell you. My spouse had asthma as
Mm-hmm.
a child, but I don't think anyone else in the family has had asthma, hay fever, or eczema.
Okay. Mm-hmm. All right, Miss Martha. So I would like to bring it to your attention that your daughter currently is now stable. I checked her vital signs. She is normal and just along with the mild wheeze and no cause for concern. Please don't worry about her condition. She is absolutely right now. So apart from this, I would like to outline some further steps. May I?
Yeah, of course, nurse.
Okay, I would like to just explain to you regarding doctor. Doctor is the one he will assess your daughter, and he is the one inform to you for further investigations or tests. And further that, he is the one just tell you about diagnosis, and we'll discuss about the treatment. How does that sounds?
Yeah, that's perfectly sound, nurse. I really appreciate your point. But I don't want all these things to go ahead. I just
Mm-hmm.
want some information. I want to
Well,
whether my daughter has asthma. That's it. I want to know if my daughter has asthma. But I am pretty sure that she has asthma because of her symptoms and because my spouse had it as a child. I just want you to confirm that my supposition is right. I'm sure.
mm-hmm. Okay, all right, Miss Martha. I can understand your concern. If I were you, even I will react in the same way. But I'm so sorry to say you, it's not our job. It is here. Just doctor is the one best person to diagnose the any disease. Is that clear to you?
Yeah, of course, nurse.
Okay. Furthermore, I would like to just explain to you regarding this situation. At this young age ages, many of the children's many of the children's you can say suffering from these symptoms. So don't worry about that. There is nothing to be alarmed. Is that clear to you?
That's of course absolutely clear, nurse. And what
Okay.
am
Do
I
you have an?
supposed to do
Mm-hmm.
now?
Okay.
What am I supposed to do now?
Okay. For right now, you have to just wait for a doctor. Please, you have to just go to the waiting room. Can you?
Yeah, of course, nurse.
Okay. So thank you so much. Thanks for giving me answer. Is that okay to you?
That's very clear, nurse.
Okay, you can back to go waiting room and wait for the doctor. I reassure you that there is no need to worry, and I will call you as soon as doctor becomes available. How does
Y-
that sound?
That's fine. And thank you very, very much for your help. I'll go
Okay.
back to the waiting room and I'll be waiting there until my daughter will be called to see the doctor.
Okay. Thank you so much. Thank you so much, Miss Martha.
Thank you very, very much, nurse. Thank you once again. Yeah. So, right. Essa Suleman. Yeah, that's fine. I can tell you to feel proud because you have definitely improved. Earlier you were nursery, but now you came to KG. Definitely not to PG. It's not an overnight point, but definitely for this particular card, I am asking. Others, that is different. Yeah. So now let me give you some points here. Let me discuss some points. You can mute your, yeah, you have already muted. That's fine. That's I because I demand silence when I speak. Yeah, very good. That's a good symbol. Yeah, I have noted some 9 points here. 9 points I have noted for you. Okay, because I cannot note everything, and even if I tell everything, yeah, that will be a problem. So no need. For each topic, 7 to 8 will do. This is fine. You are actually doing very well. I can tell you for this, you might have got 330 to 370 in between, anywhere it may be. Okay. If I correct, definitely I'll give you only 330 because I'm okay. The toughest taskmaster, you know that. But others may give you 350 or 360 or 370 also fine. That I don't bother about that. As of now, for me, I'll give you 330. Yeah, lot of improvement. Lot of improvement I have noticed. That's a good sign because you are very, very obedient. You are ready to learn. Yeah. Now you have said, I have just saw the symptoms. I have just saw the symptoms. Just means just now. So it must be in the present tense, but you used past tense, saw. Okay, saw. But when you use have, it should be have seen, not even I have seen. Just now, I have seen, or I have just seen the symptoms. I have seen the symptoms just now. Note down if you want. Otherwise, you can note it down from the YouTube later. Okay. You can just check the transcription and you can take it and you can just copy and paste and then you can edit yourself. I have just saw the symptoms. No, I have seen the symptoms. I have just seen the symptoms, or I have seen the symptoms just now, or just now I have seen the symptoms. Right, next one. Just now I get her vitals. Just now I get her vitals. Just now I get her vitals. I get her vitals. Simple present tense. Just now I have got her vitals. Present perfect. Like the same thing earlier one. So you have a problem with present perfect tense. You have a problem with present perfect tense. Be careful. So you already know where you are falling. So there is a pit somewhere and you already know that there is a pit. Next time you have to be careful. You will not fall into the pit. Once you fell, next time you will be careful. So you made a mistake. Next time, not once, twice you made the mistake. Present perfect. Two times, two sentences, same thing. Just now, I have got her vitals. Just now, I have got her vitals. Just now means finished. Recently completed, not past completed, recently. It's not in present, it's not past, it's present perfect, means finished. Next one, you have some pauses and breaks. Still, you have some pauses and breaks. But that confusion and no confidence, those things, you erased them. Now you have confidence. Now you don't have confusion. You don't have that stress or that anxiety. You don't have them anymore. You have overcome those points. That's, a great comeback. You are in the battle again. You got wounded in the previous battle, first battle, and now in the second battle, yeah, in the Second World War, you have recovered. And maybe definitely in the Third World War, you will beat me black and blue. Yes. Next one. These are pauses and breaks. And there you're making some unnecessary sounds. Ah, ooh, like that. What is this? Are you fighting some karate or something? Ooh, your Jackie Chan's sister or what? I don't understand. What is this? Ooh, in between. Suddenly you're opening your why you are opening your mouth in the first place? If you don't have anything, just zip your mouth. Nah. And when you want to start, you start. Get back to the zip lock position. Don't open your mouth. If you open your mouth, there comes some sound. And if you don't have anything which has come from here to here, then you'll be blank. So don't open your mouth until you're sure that you know something that you have to speak. That's the point. So train your tongue, train your lips, train your vocal cords not to function unless and until you are ready. The lips should be closed, the tongue should not dance, the vocal cords should be still. Okay? You can do it. When I can do, when many others can do, you also can do. Nothing hard work here. Just to close your mouth. And when you're ready, then open. Instead of opening your mouth and saying and stopping for 3 seconds and then speaking, just for 4 seconds and then speak. Na? Simply opening your mouth and saying and waiting for 3 minutes. So 1 minute plus 3 minutes. Shut your mouth for 4 minutes. Na? That's fine. Not only you, many people have this problem. And then you said, I am sorry to say you. I am sorry to say you. I am sorry to tell you, not say you. If you want to use the word say, don't use the word you. Say will not take an object. Tell will take an object. I will tell you. I will say. I will say. Or you have to say to you. I will say to him. Okay. I will tell him, but I will say to him. Or I will say. That's enough. I will tell him. Or I will say. Or I will say to him. What you use is, I'm sorry to say you. That's wrong. Next, you said, the doctor. Next, you said, I did not say you said me or you said to me. Both are right. You said or you said to me. Both are right. But you said in a wrong way. The doctor is best person. The doctor is the best person. The doctor is the best person. Why did you not say the? Best is superlative degree. Good, better, best. Whenever you use the adjectives in the superlative degree, best. The most beautiful, not most beautiful, the most beautiful, the cleverest, the tallest, the shortest, the sharpest, the fittest, the strongest, EST or MOST. These words are there. Before that, the is a must. The strongest is EST. So before that, the strongest. Most beautiful, most, before most you have to use the most beautiful. I hope you understood. If you have understood, type there yes, Essa. This is one more mistake you have done. Next one, I would like to explain to you. I would like to explain to you. I would like to explain to you. I would like to explain you. Enough. To is not necessary. That's correct only. It is correct only. There is no wrong in this sentence. It is correct. I would like to explain to you. Correct. Absolutely correct. 100% correct. But even if it is not there also, there is no problem. There is no harm. There is no danger. All right. I would like to explain you. Enough. When this word you can use or you cannot use, better not to use. Nah? You will say one word, na? The other person also knows that you have excellent quality, that you are using redundant, not using redundant words. Means not redundant means more than what is necessary. There you go. The next one you said, many of the children's. Many of the children's. Now, what is this children's? Child is singular, children is plural. Child is singular, children is plural. Then where come this children's come? Books. Did you think that children and children's? That's absolutely nonsense. It doesn't make any sense. So you just say children. Many of the children. Why did you use children's here? And that too, you are telling, come on, bull, come and hit me. I want to die, like that. I'm a bull and you are coming in my way and you are telling, come and hit me. Wow. And you are telling them, announcing more time, come on, come on, come on. You are telling again. What? Children's. Many times you told this word children's. So you are repeating and repeating and repeating the word. You go into the video and check it out. First thing is you did a mistake. And second thing, you are showing that, did you notice my mistake? Did you notice my mistake? Did you notice my mistake? If not, at least notice now. That is the meaning. So you are doing a stealing something and you are telling the world, I am stealing. Come on, catch me, like that. What you are doing to yourself? You are doing self-harm by repeating the mistake. So be careful. When you repeat a mistake, it is double danger. So first one is wrongly you have said again. Wrongly you have said again, children's. That means one mark. First time you lost 1 mark only, children's 1 mark. But next time when you are repeating, children's, again 1 mark you lost. And repetition, another mark. That means second time when you are repeating, 2 marks you are losing for the same. And again you are repeating, again wrong, and again repetition. Again 2 marks. Every time you repeat it, it is 2 times you are losing your mark. If it is a mistake. If it is not a mistake, repetition will give you 1 mark minus. But if it is a mistake, 2 marks minus. Be careful. Be careful. And you are keeping your mistake open in front of others, saying that this is my mistake. Useless fellow, you are not able to notice my mistake. You are telling that fellow, you are making him his work easy by showing the mistake. Yeah. And children's, the word is repeated. These are some of the few mistakes that you have committed. Right. So now I want you to, I'm unmuting you. You can speak. I am unmuting you, Essa Suleman. Yeah, I have unmuted you.
Yes, sir.
Yes, go ahead. The stage is all yours.
No, sir. I will just know all my mistakes, and next time I will avoid.
Yeah, that's the spirit. That's
Yes.
the spirit. If you want to improve next time, you have to do a lot of hard work. For every 5 minutes you speak, you should prepare for 1 hour.
Okay, sir.
You understand? Next speaking you come, okay, after
Yes.
1 hour. Now it is
Yes, sir.
11:16. So after 1 hour means exactly 1 hour afterwards, I will take you another space session. Little here and there before or after, but so 12:30. Let us take 12:30. You can get another speaking session. Okay. I am going to hit you hard today. I'm going to blow you up today. Be ready for the blast. Okay. Right.
Okay, sir.
Yeah.
Thank you, sir.
Yes, up to you. Now you can
Thank you
prepare the
so
next
much.
card. Next card. Yeah. How do you feel about the sessions? What is your feedback? Is Simon sir helping you achieve? You came for a short time, but even in the short time, I gave you,
A lot
what is it?
time.
Yeah. Tell me what benefit you got from my sessions. There are some students who want to be my children. They want to register with me. So there is some Kepti. I don't know the name of Kepti. Kepti, can you type your first name and second name? So there are some students who want to join. So your message may be a good message or a testimony for them. They can decide. They can all they can decide from my sessions. But your words, that's better. If I tell it is a self band baja or something, so I don't want to beat my own band. So you tell how these sessions are helping you and how much personal attention I am giving you.
No, sorry, a lot of personal attention from your side. I always get whenever I message you, uh, at that time you are replying me, and really these sessions for us, all of us, very helpful and very informative. And in these 3 4 days, really, I got many things: vocabulary, confidence.
Yeah.
So making sentences, not just sentences, quality sentences, especially in writing session also. So thank you so much, sir.
One
I
last
really
question.
appreciate you.
One last question. You have admitted, you have been admitted for a short term crash course, maybe 10 days or 12 days, right?
Yes, sir.
And you
And you
paid
also given me
5,000 rupees, right?
discount. Yes.
And did you get the worth you paid or less than or more than?
No, sir. More than.
Yeah, that's
Really.
fine. That's fine. I
Thank you
really,
so much, sir.
yes. So that's
I
the
wish
end.
thank you
Yeah,
so much, sir.
you will. There is no I wish, I will. That's all. If you work hard, struggle, you will clear. Okay. Don't think of
Inshallah.
second option. This is a do or die battle. If I lose in this battle, next battle, you are going to die. You are crazy.
No, no,
I don't want you to die this battle. If you are dead,
no,
then
sir.
how can you fight for the next battle? This battle only. Try to survive. This battle you should win. That's all. Okay. Right.
Yes, sir. I will achieve. Inshallah.
Yeah. Next,
Thank
who is
you
the
so
next
much,
one?
sir.
Rakil Kurram. Manimoli. Yeah, Manimoli, Rakil Kurram, and we have Abedia. So three regular students we have. So who is next for the speaking session? Rakil. Okay. Are you interested? Then Manimoli. Are you interested? Then Abedia. Are you interested? Yeah. Come on. Whoever is interested, you can write according to your messaging. Then I will schedule the sessions. Yeah, Manimoli is first to respond. So fourth card is for Manimoli. Manimoli next to you. Manimoli Elamaran. Nursing. So okay, select one card. Which card you want to select? You want to select the same card or anything else? Up to you. You can select and I'll give you the card and you'll prepare for 3 minutes and you'll do the sessions. After that, next one is you can take the same card, no problem, or any other card you want. I have given you the cards, right? I have given you the cards. Next one, fifth one. So fourth one is Manimoli and the fifth one is Rakil Kurram. Rakil Kurram or Rakil? What's the name? Rakil Barkat. Sometimes you say Kurram, sometimes you say Barkat. I don't know what you are doing. Huh? Okay, I'll write what is here. Rakil Kurram. Nursing from Pakistan. Yeah. Number 6 is Abhedia. Abedia. 6 is Abedia. Abedia second name. Abedia Jogdand. Jogdand Nursing. Yeah. This is the order for your speaking session. Yeah. So now I'm going to send you the cards. Okay. Where's this girl's name? New girl. She is very much interested and she's attending. Kepti. Yeah, Kepti. So you send a message to me on WhatsApp. I'll give you the cards. Okay. So please message me on WhatsApp. I'll send you the cards. Yeah. So I'll send you the cards there. Okay. So here it is, the cards. Yeah. Manimoli, now I am going to do card number 5. Very good. So Manimoli, then Rakil, Abedia, Rakil, then Abedia Jogdand. Then did this girl send a message? No, I did not. Yeah, 965. Is this the number 965630? That's a Kepti. Yeah, ending in 1630. Is this your number? Yeah, I think that is you only, maybe. So I have sent the card. So that is Rennie Thomas. That is not yours, sir. Okay, you can message me on WhatsApp. Yeah, I did not get here this one, so I did not send you. So you can message me. Okay, fine. So next is Manimoli Elamaran. Yeah, 233. Yes, good morning. I got it. Keptia. Keptia. 233. Yes. Yeah, Manimoli, is this the card, right?
Number 5.
Yeah, is this the card?
Yeah.
So 51 squamous cell carcinoma, right? Is it squamous cell carcinoma? Manimoli? Is it squamous
Yes,
cell
sir.
carcinoma? Hello? What's happening with your mic?
Yeah.
Is it
Yes,
squamous
sir.
cell carcinoma?
Yes.
Take care of your mic. It is closing every time. Okay. Yeah, be ready.
Okay.
Yeah, you can prepare for 3 minutes.